to talk. I was asking these people because they're all from the Philippines. I was asking them about what's going on with their families and the eruption of Taal. More on that in a minute. Value meals for value deals like the pancake puppies. I'm talking about Denny's now. Pancake puppies, spam sandwich, French toast slams, classic burgers, loaded chicken skillets, loco moco, and plenty more. And it ain't going to cost you a lot of money. Don't break the bank. Take the family for dinner tonight over at Denny's. Portions of the Ray Gibson Show also brought to you by American President Lines, APL Global Presence with a local home.
The Ray Gibson Show. Any speaker, anytime. Morning talk that matters.
So one more hour of the Ray Gibson Show, and I can tell you exactly the first thing that I'm going to do as soon as the microphones are off and the cameras are off is I'm going to go and bite right through this. We got this from 76 Circle K. I believe today they're debuting a brand new product that you can get when you go. They sell gas, by the way, as in addition to food. They sell hot and spicy Spam red rice musubi. I don't know if you maybe you've had this in your head about different ways to do it. I like Spam musubi. I'm a big fan. There used to be, and Charlie might remember this, over at the Hotel Nico, they used to, in the Japanese place, they used to have Spam sushi. And it was at the, and I was, at the time I was working in Agania, and it was always one of those things like, I got to get in a car and drive like a maniac all the way down to Nico and get my hands on some of this Spam. And it was so popular they had to discontinue it. apparently nobody was eating anything else on the menu. They're just going in there for the Spam sushi. Anyway, Ray Gibson Show, you can hear the room begin to open up a little bit more on your speakers, and the reason why is I got folks in the studio as usual around this time. It's the Guam Regional Medical City, our partners in healthcare, and that's the name of the segment of the program that we're about to launch into here with 1, 2, 3, 4 mic video positions, and we'll kind of go around the room and say hello to everybody, and I think we're going to start with age. I think I'm the oldest, so good morning. My name is Ray Gibson, followed by Dr. Carmelino Galang. Good morning. Welcome to the program. Excuse the mess. Get right up close to that microphone. Say hi to everybody, and we'll ask you the basic question: what the heck does an orthopedic surgeon do that nobody else in the hospital can do? So we'll talk about that, and then we've got another orthopedic technician, Manny Dela Paz, and they tell me that your nickname over at GRMC is Handyman Manny.
Yes, that's correct.
You're going to tell me a little bit later on how you got that particular tag, and nothing happens without other assistants and folks in the at GRMC, medical assistants in the orthopedics department. I have Roseanne Tabbada and there's also Anne Gutierrez. Good morning. Welcome to the. Which one is which? Which one? Roseanne, and you're Anne.
Lee Anne.
Lee Anne. Okay, well, welcome. I'm sorry. Welcome to the program. Excuse the mess. Great to have you guys in here. Now, we were talking originally before the break about the current events in the Philippines, and some really interesting things happening with the Taal volcano going up. I've got friends and family out there, and just it's amazing because we've got the ash fall now in Manila, right? So I mean, you walk down the streets and there's ash all over the place. And another friend of mine, I think you guys know her, Marilu Bersaman, so she's sending me now. Apparently, one of the things they're doing is they're gathering up all of the ash and turning it into like concrete blocks. Yeah, that's what I said, and I'm like, Mike, can you look that up for me? The ashfall cinder blocks, whether or not those things are as strong as say concrete and cement. I don't know, but the Marilu said, yeah, those things are apparently very kind of strong. So nice, we got common friends, right? Anyway, so now your family, Leanne, is they're volunteering, right?
Yeah, pretty much their company. My auntie owns the company, so they're pretty much doing the.
Is it just like cleanup and that kind of thing?
No, they're giving out foods, reliefs for patient. I mean, for people that needs water, foods, or whatever.
Boy, that's got to be a lot of demand on that. I've been to Manila, and there's places there.
I think there's lack of water.
Yeah.
Majority of it's the water.
So the other thing I'm told is that they're having a hard time with is something that you guys go through all the time over at the hospital. Is that surgical masks to be able to keep the ash fall out. They're having a hard time keeping that, and they're going to find some water, put it in a towel, and cover that cover your face with it and try to breathe through it. It's, as we've said before, it's not the same kind of ash like you'd find in an ashtray with a cigar in it, or the kind of ash that you get after a grass fire or something like that. These are actually literally fine particles of glass that are floating around in the atmosphere, and you're not supposed to breathe it. Earlier today is another picture that I got from Marilu, and it's an image of a woman with a severe eye, a gash in her eye. People are beginning to report that now. They're walking through the ash, and the glass is literally cutting their eyes. So it's just crazy what's going on out there. Certainly a nuisance and an inconvenience, and anybody that's tried to do any traveling in the last 72 hours between here and Manila knows just how difficult that has been. So I imagine that all of the communications between Guam Regional Medical City and Medical City in the Philippines has all been done with WhatsApps and telecommunications, right? About that way, because nobody's getting on the plane. Dr. Carmelino Galang is an orthopedic surgeon at Guam Regional Medical City. And how long you been with the outfit?
This is my 4th year.
Okay. So been since about day one then with GRMC.
No. I came there 6 months after they opened.
I got you. And now, I had been in the hospital before and had seen some of the surgical suites, so I'm sure that you're highly appreciative of the work that went into the design and the construction of the surgical suites that you guys work in.
Yeah, we have about 7 surgical suites right now.
Okay, and, so that's good. You'll be able to churn to get people in and out.
Yes.
Now, what does an orthopedic surgeon do? I mean, it sounds like a basic question, but I've never needed one, and the only time I was talking about on the radio before you guys got on, the only time that I'd ever pondered anything using the word orthopedic was when I was a little kid. I was flat-footed, and they made me wear ugly shoes with these inserts in them. They were orthopedic shoes, and I hated them. So I've kind of avoided the conversation all these. What's an orthopedic surgeon do?
Well, we treat any problems with bone and joints. From children to old age.
Okay, all right. So basically a bone doctor. So
yes.
if I'd never broken a bone in my life, which is I'm 57 years old. Knock on wood. Hopefully it doesn't happen. I might have had a couple of fractures or two, but no actual breaks or anything like that. So I've never actually needed to see an orthopedic surgeon. Tell me a little bit about some of the bone stories that you've got here on Guam and the joint stories that you've got here.
Of course we do a lot of fractures. That's basic stuff. Also, as you get older, you get arthritis, of course. We treat that too.
Now, okay. 57 birthdays. I'll be 58 on my next one. No, I got I got to drive by, right? I've got to drive by consult. I can get. So every once in a while, the girls are laughing. Every once in a while, let's take for an example. I grab a water bottle, and sometimes the thing on a water bottle is easy to take off, and sometimes it's difficult. And I've discovered recently that it's beginning to get in the first and second knuckle of my hand. I begin to feel a little bit of pain when I'm struggling to open a bottle of water or a jar of pickles or something like that.
Yeah.
That's not arthritis, right?
That's part of it.
No, it's not. No, I'm looking for good news. So, no, Ray, you just got to. There's a thing. You crack your knuckles too much, and that's why you've got that.
Well,
is that onset of arthritis?
Yes. As we get older, of course, there's wear and tear in the joints. And if you use it more, then they wear more.
Well, I don't open that many bottles of water. I'm a beer guy.
But that's the problem.
Actually, it's that same motion when you open a bottle of Budweiser and Bud Light. It's exactly the same thing. Use a can opener next time. That's save you.
A lot of people here, they jog us, all the marathons and walkathons you do every weekend. So I see a lot of patients with knee problems.
Huh. Okay. Well, a marathon runner here going to be doing the half marathon coming up.
2K, 5K, and even old people, they do it. And of course, they can't do it anymore.
Okay, so
to that point.
Yeah, but there's got to be. This is 2020. What's the miracle cure?
It's hard to say.
I've got a scalpel, Gibson. That's what your miracle cure is. That's okay, because now I'm in a. That's an interesting topic to me again as a runner, and somebody that we've all got joints one way or the other, and I guess as time goes by, you begin to lose some of the function, or the functions become.
You have to stay flexible, and your muscle has to stay very strong to minimize the pain.
Okay, so we've got
that means exercise.
Oh,
the right exercise.
So you're talking to the exercise guy. I'm a runner. I'm out there. I move weights around, that kind of thing, trying to keep myself as limber as possible while we do all of this stuff. And that will help by way of dealing with the pain, maybe. But will it mitigate?
Yes, it will mitigate it.
Okay, so there's mitigation.
Myself, I have arthritis in my knee, and I treat it with. Again, I tell my patient, stationary bicycle. They've heard that. I mean, every time I see them, knee problem, you do a stationary bicycle.
Interesting.
It helps.
Yeah.
Because it helps me, and
So,
that's my.
are there things that I can put in my diet?
It doesn't matter, the diet, as long as you don't get overweight.
Oh, well, I do try not to.
That's it. No, that's
Had pizza for dinner last
unless
night.
you have a gout problem. You know.
Oh, if you want to get into the gout, because there's people that are listening that go, oh, we got a doctor in there, ask him about gout. There's the two things. There's always ask him about gout, and then there's ask him about medicinal marijuana, and maybe the efficacy of medicinal marijuana in pain management for arthritis and big bone breaks, right?
Yeah,
So I mean, maybe there could be some of that between now and the end of the program. So more on keep going. I'm going to go back to the arthritis question because so I take a fish oil supplement.
Okay.
Yeah, is that doing anything other than giving me?
There's no science in it. So
Now, what about my old man had arthritis in the knees, and for many years he was able to go back and forth and get cortisone shots, and that helped with the pain.
The
But
cortisone
then
shots,
after a while, you couldn't take them anymore.
The cortisone shots is just a temporary thing.
Yeah, eventually it's no longer effective.
Yeah. Yes.
There was work being done years ago, and I don't remember what specifically that it was for, but it was for something with the joints, where they were taking from the rooster, the top of the rooster, they were able to spin out some kind of drug that helped with the pain and lubrication in these joints.
Yeah, it's still not. There's no scientific. Evidence in that yet.
Well, but there are people that are still trying it, right?
Yes. Some reason people are helped by it, and some people are not. So it's just
like many forms of medication.
Yes, we call that herbal medication.
So if I was developing, say, arthritis in the knees, and define for me what arthritis is, so I know that I'm talking about the same things, and we can then move into the therapy that I wanted to discuss.
Well, the problem with arthritis is the lining of the joint. It has to be smooth and thick.
Yeah.
As we get older, it's not as smooth anymore.
Right.
And the thickness of the cartilage, I call, will wear out.
Interesting.
That's when you wear out that thin cartilage, that's when you have a lot of pain.
Now, can I? Obviously, there's things like knee replacements, hip replacements, and things like that. So, when the cartilage begins to wear away, I might be able to go see and say, Dr. Galang, could you do me a favor and take out the old knees and put in the new and improved?
Yes. That's the end game, I call it.
Now, is there still pain involved? Will I still have the mobility that I had prior? Is there a significant improvement?
Oh, yes. I consider call it about knee replacement or hip replacement. It's a pain procedure. A lot of my patients are helped by it.
And you can do that at Guam Regional Medical City?
We can do that there. Yeah.
Really?
Yes.
Do you have the parts? I mean, no, I got it. The technicians are laughing because they're going, it's like going to Napa. Yeah, I need a new pair of knees.
Yeah,
how do you fit somebody for that? I mean, if I went to you today and said, this knee is giving me a hard time, you said, we'll take out the old one and put the new one in. How do you?
We have a lot of sizes available.
It's like putting like shoes. Like you just say, this is.
Yeah,
I'm fascinated.
During surgery, we size it, and then we have different sizes. Then we put it in.
Unbelievable. So there's like a warehouse in the back with.
We have a big tray, lots of tray.
I'll be darned. So then now, obviously, you don't do any of this alone. In addition to the technicians and folks that we've got here in the studio, what other doctors, what other specialists do you work with over at GRMC?
What I do is I usually have a team. A team that helps me. Yeah. A first assistant, and then the scrub nurse and the circulating nurse. That's all I have. That's
for your team, though. But do you work with other teams? I'm thinking there's great neurosurgeons and people that you work with over at GRMC.
It's a difficult case. Then we collaborate.
Yeah. So I mean, it's not just bones in the knees and the hips and places like that. I mean, it could go all the way up the vertebra and the small bones in the neck.
We do have a spine surgeon,
which weren't hurting until I just started thinking about it. Now I'm thinking about I've got these bones in the neck, and I now want to crack my neck over and go off in this direction. So how much there's other fields obviously when we start talking about bones and muscles and things like that. How much is there a collaborative effort, say, between a surgeon like yourself and a chiropractor as an example, somebody that can go in and say, yeah, here's the issues that we're seeing, and maybe you might be able to get some relief and possible correction if you go see a chiropractor.
Yes, we do.
So is that, I guess my end goal would be that I don't want to be your customer. I don't want to get to a point, you know, outside of an accident where I need that kind of...
A lot of my patients, they go to the chiropractor first, and then if it doesn't help, then they end up in my clinic.
Right.
That's the thing.
So, and tell me a little bit. Is there a reliance on significant imaging technology? I mean, and you guys have significant imaging technology, you know, 100 slice toasters and things like that over at Guam Regional Medical City. So I could go on a complete imaging tour of GRMC and then have them send all the data to you.
Yes, we have an MRI and a CT scan. That's all I use a lot.
Right.
In my practice.
And still old-fashioned x-rays every once in a while?
Well, actually, I'm an old-fashioned guy. I rely on my x-ray first. When they get to me, they all have all this fancy stuff done. And I tell them, I can see what your problem here in the plain x-ray.
Right.
So, anyway.
Absolutely fascinating. Dr. Galang, now there's, when we start talking about bones and things, you know what, I'm reminded of something, and it's something we talked about not that long ago. I was asked by the bone marrow registry people. There was a possibility I was a match for somebody, and as it turns out, I was a match, but they've declined. They sent me a letter over the weekend and said, we're not going to be, you're off the hook, basically. The patient, there's reasons why. Either their situation got better or their situation got worse, or they're going to pursue another therapy. But in this particular case, for that particular patient, I'm no longer a candidate to help them out. And I'm really disappointed about all of that, because I was hoping that, number one, I might be able to save a life, and number two, it would have exposed me to a whole different level of doctoring out there. And you know, being an orthopedic surgeon, you know about the value of the marrow and what it provides to the body. Have you done any of that kind of work, marrow harvesting, or?
I do bone grafts in bones.
Now I've heard that's another phrase that I've heard 1,000 times. Bone graft. I mean, I'm thinking of, in terms of gardening, where you take one slice of something and marry it up with a slice of something else, and then you make big mangoes.
You get a piece of bone somewhere in your body, or somebody else's bone, then you put it in where you need it.
And now, when would you use that procedure?
For example, if your fracture is not healing, you need to use it as a graft. And then, for example, you are missing a big chunk of bone. Right. Then you put it there. You replace it.
Now, and I am my own donor in that case?
You are, or somebody else.
Huh.
Yes.
So, but didn't that leave a gap someplace else in my body?
No.
No, it doesn't really. Yeah. Will it grow back on the other part?
Yes.
No, it doesn't.
If it will connect. You know, it will connect.
Right. But I'm saying, so if I have a problem because I broke my bone over here, it's not healing properly, so we'll take it from the other arm. We'll graft it.
No, you don't want you want to get the other arm.
Oh, okay.
You don't want to jeopardize the other arm.
So where would you
get it for somebody else?
Oh, I see. So we'll jeopardize somebody else's arm.
Yeah. We have bone bank. You can get it from there, what you want, and they'll give it to you. Let's say I need this bone, they'll give it to you.
This is an eye opener. Number one, you get spare parts over at GRMC. There's actually a room with spare kneecaps and things like that. So if you go in there now, and this might come as a surprise to a lot of people, that you can get that kind of surgery here. I think a lot of folks would go, that sounds like something that you'd need to get on a plane for and go to Medical City in Manila, or maybe someplace in Hawaii or the States for that kind of care. And so I'm going to assume that the efficacy of that surgery here is very high. One of the reasons why...
excuse me, it's not done very often, though. But, we have to set it up.
Sure.
That's why...
But maybe it's just a question of more and more people that need to recognize that they've got a problem, and then go see their doctor, and have the doctor say, go see Dr. Galang over at GRMC, and he'll pull out the old ones and give you brand new chrome and glass. Now, do the new ones last as long as the one that you're born with?
They last about 15, 20 years.
Okay, and in a lot of cases that might be the rest of somebody's life.
That's why we want to do it when they're a little older. Let's say you're 65. If you live to 80, then you probably won't need anything.
We got a big diabetes problem here on Guam. Right. Do you see the complications? Do you take care of those complications?
Yeah, I see lactose.
Yeah.
bad bad ankles.
Would you
a
be
lot
the
of
guy
infection.
Would you be the guy that does the amputations in those cases?
I usually do. Yeah.
Ouch.
We do have podiatry too in the hospital.
See, there's a joke in my head saying that's where we get the spare parts. That's where that's.
No.
So we got that bone bank we were talking about. Yeah. No. This is completely.
Those are infected.
Yeah, you don't
want
necessarily want this. A fascinating conversation about all of this. Now, I'm also a hiker. Yes, and when I'm on the trail and doing the hiking, one of the things I'm very concerned about is that every once in a while somebody says, "Oh, you need to go and jump off that waterfall over there," and I'm going, "No, I don't think I'm going to jump off the waterfall," because I know people that have jumped off the waterfall and ended up in a wheelchair for the rest of their life. So I'm not going to be doing anything like that. But I also know people that might have taken a spill on the trail and actually broken a bone. On a scale of it's just a fracture to wow, I need to get surgery done. What kind of injuries have you seen with bone breaks here on Guam?
Oh, I've seen a lot. The worst thing are the accidents, the car accidents.
Yeah,
Those
a lot
are
of
the worst
forces.
thing. Impact and but a lot of the minor ones, a lot of old people, they fall and they break their hips.
Yeah.
A lot of times because their hips are fragile. So we do that. We see that a lot at GRMC.
You would think that once upon a time we'd evolve into a species as we live longer, where we get a little bit more density in the hip bones and they last a little bit longer. Why do they go brittle after a while?
Okay, because the functioning system in the bone, there's a disconnect. The calcium doesn't get to your bone as you get older.
Oh.
I don't care how much calcium you take; it's not going to get into the bone. Because the mechanism is already not working anymore.
That sounds kind of grave because I take a supplement that has got some certain amount of calcium in it for exactly that reason, so I don't turn into a bent and broken old man.
There is some medicine that you take though for that. So there is some medication you take.
Yeah.
To help that mechanism
to last a little bit longer.
Yeah,
work more efficiently.
Yeah.
So is there something that I should be doing now? At my age, maybe some younger listeners going, I don't want that to be me. Is there a supplement that I can take or an exercise that I can do just maintain?
Just stay active. That's really what you need.
Yeah.
Once you stay inactive, then that's when everything falls apart.
Do you see a lot of that? I want to call them green stick fractures, right? That's the one where the break is so bad that it actually pokes out of the skin.
No.
You don't get that too often.
Green stick is very I see some of that, but it's not seen very often.
Do the girls faint when somebody comes in with something like that?
Not really.
But I mean,
they're used to that.
Yeah, let me just spend a couple of minutes with the technicians around here and find out a little bit more of what they do. So is this guy a slave driving boss? Is he one of those surgeons? He get a ding 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 like that? No. So how do you back these guys up? How do you back up Dr. Galang and Handy Manny here?
So we all, me and Roseanne, we have our own tasks. I pretty much, we both take vitals, assist with procedures, but I do, one day she can be handling the referrals, I can be handling his surgery. So it's like a shared task for us.
So you hold kind of administrative positions as well as in the studio?
Yes.
Clinical positions?
Yes.
Is that common?
We've been doing it for so long.
Well, I guess the reason is, and I want to say that this sounds like it's very, very comforting to me because the same person that I'm talking to in the office is actually going to be in the room with me while I'm having some of these procedures done. So I think that makes me feel a little bit better because there's a continuity of the care with the team from actual sitting out, help you fill out the forms and the paperwork, and then into the actual operating room where the work gets done.
We don't usually. I think it's more of simple procedures. We're in the room, like cortisone injections or like staple removals. Those we're in.
Okay, so you can stop right there. I'm sorry. He's talking about setting bones and doing surgery and all that stuff, and I'm cool with that because number one, I'm sure I would be out. I'm sure that somebody would give me something to breathe, count backwards from 100, and I'll see you guys when it's all done. But injections, you're talking about a cortisone injection. That's a needle about that long. Right? It's
not that long.
It's as thick as a number 2 pencil, and it goes directly into the bone, right?
It's not that long.
It's not that thick.
It's the tricky part.
So yeah, tell me. Okay, start with that cortisone injection. Tell me a little bit about what that's all about. And I'm getting sweaty palms just talking about it.
Because we don't go to the surgery with him.
Right.
We set that up. But for like minor procedures that's done outpatient, we can assist with that.
Right.
So for the cortisone injection, we just we set up the things that we need and we assist Dr. Galang during the procedure.
Right, and so what do you use to calm down the patient when they see because I'm sure you're putting it in the bone, right? I mean, doc, when cortisone is cortisone, I don't
in the joint actually.
Yeah, I don't want to.
We put some numbing medicine.
Thank God.
Yeah.
Okay,
Yeah,
and
that's
shot for the patient.
and then we use
Jameson.
Then we use a very small needle. It's
Small
really
needle. Okay.
Almost painless, I think.
He says almost, and then the other word that she used. I don't know if you heard Lee Anne say the word staple removal.
Yeah.
So why do we need to have staples in anywhere in my body? Why would I need that?
Well, after the procedures in the surgery with Dr. Galang, he usually staples the incision that he makes. And then you come to us after a few days.
Didn't they teach you how to sew in medical school?
Yeah.
We're using staples now.
Yeah, it's
Okay.
stapless.
It's staples.
Faster.
It's actually very fun, but on the patient side,
Right.
of course, they are scared.
Yeah.
So we're just taking, we just take it one by one, and they're like, "Are you counting?" We're like, "Yeah, we're under like 43."
But there's still the numbing agent though, right? There's still some that you put on that so as you're actually ripping the staple from the skin. No.
No, we just clean it and then make sure it's sanitized before we actually do touch it, because you're introducing a foreign object into the incision, which is our staple remover. So we're just like, okay, casually.
But will I feel it? I mean, so I've already had the procedure and I've gotten whatever it is that he did.
It's like an ant bite.
Yeah.
It's like an ant bite.
This big.
It's a big ant. It looks like a Cocker Spaniel size ant, but it's this is some fun conversation. My producer is sending me into a break, and if you've got some questions that you want me to feel these guys out with on Facebook Live, just go ahead and write it up, and you can also send it on the WhatsApps 988-5874. That's 988-5874. This is one of those things that at some point where all of us, I got a feeling, going to have to deal with, and so it's nice to know that we can do this work here, and that we've got a team that considers it fun. And so we'll talk with this fun team more about the orthopedic surgeries and some of the other services available. We haven't even met Handyman Manny yet, so I'm sure there's a fun conversation about that. It's all ahead. Hey, swing by the nearest iConnect and ask them about saving some money for you. They've got plans on mobile internet, even push-to-talk plans at iConnect.
From the start of the NFL football season, Point listeners have gotten together in friendly competition to battle it out in the Points NFL Pick'em Contest. Along with weekly winners picking up great prizes, we have also awarded our grand prize winner, Art Hameister. Art correctly guessed 170 picks. Wow. Good enough for him to win a new iPhone from GTA. Congratulations, Art. Thanks to all who participated in the Points NFL Pick'em Contest. Brought to you by Current Guam, with special thanks to GTA.
I got you. Just a general commentary and thumbs up from a number of listeners watching the program tonight. Forrest Gump, yeah, that's me. Nate Horn asking about any new AFO prototypes, and I don't know what an AFO prototype is, so I'm not even sure if that's germane to this conversation. Mike, does that ring a bell? Does that mean anything to you?
Yes, Handyman.
Handyman. Well, all right, so the perfect segue to talk with Handy Manny is Manny Dela Paz, orthopedic technician at the Guam Regional Medical City, in part of the orthopedic team that they have, and hopefully nobody breaks a bone, because I've got the best guys they've got here in the building right now, and before too much longer we'll get you back to work. So Handy Manny Dela Paz, how did you get that handle there, Kuya?
Well, I have 28 years experience in States doing prosthetics and orthotics. So I'm mostly the senior head for the technician. I train people doing all these devices.
Nice. Now, start with the prosthetics. as in, and we'll begin the conversation there. Because I guess the goal is with many prosthetics, so that they're virtually undetectable, right? I mean, you something that does not necessarily call attention to itself. What's the latest and greatest by way of prosthetic devices for some of the people that you see?
Well, they have plenty new design right now, but since we're in Guam, some of the old one that we use here.
Well, first of all, how do they work? I met a friend of mine, and he had a tricky episode, and unfortunately lost both of his arms, and has prosthetic devices attached to them, and he can clamp down on certain things, and he's one of a few guys that hangs out with me in a bar. He actually has his own bar mug that is designed to work with the prosthetics as opposed to a regular. I mean, it changes your life when you go through an episode like that, because all of a sudden, back in the old days where you might be able to grip a can or a glass of something, now you can't. If it doesn't have a handle on it, it's like stairs and you're in a wheelchair. So with these prosthetic devices, how do they work? What do these guys do in order to make the clamp open and close?
Well, we're pretty much advanced right now. We do a lot of myoelectric devices. I mean, impulse from your body that makes the prosthetic to operate. And those, you're going to be trained by trained prosthetists to how to operate them.
Okay.
And the old style is those cables and wires that you use your shoulders in opening those hooks.
Yeah. So now what you're telling me is we plug in a couple of wires into the muscle?
Well, but it's not plugged in. It's more like your impulse on your muscles. They locate those impulses. So when you try to open it and close it, they detect where those areas are. And by training, you open them and close them by just operating those impulses.
Like moving your hand or something like that, or willing, if you will, the muscle to move.
That's correct.
And that makes a connection into the gizmos, into the mechanisms on these prosthetic devices.
Yeah. Nothing implanted in your body.
No, so we're not plugging in stereo equipment or home
battery
alarm system.
Operated.
They are battery operated.
Oh yes.
Okay, so they got sensors and devices like that. So like USB, you plug it into the wall and
you plug it into your car for the charging. If you go outdoors, there's no electricity out there, so you can use your cars to plug in to charge your batteries.
This is amazing stuff here, and you've got this is in the same place, the same warehouse as you have the spare kneecaps, right?
Dr. Galang is doing a different thing. He's doing all the internals. I'm doing the outside.
I got you. Now in one of the, maybe that's why it's called Handy Manny. Maybe that's the genesis of the name there. But so you've got some. Now we're talking about, I was talking about hands, prosthetic devices for hands. But do we have them for other things? I mean, can you outfit people for other prosthetics, leg devices, feet, toes, whatever? Yes,
mostly when Dr. Galang do all his surgeries, like amputation for below the knee or above the knee, those are my field of work, prosthetics, replacing those limbs, for them to be functional.
What is the process behind that? How do you do it?
Mostly physical therapy. You have to recondition their limbs and teach them how to reshape their, let's say for below the knee, try to reshape their legs, then teach them how to exercise. So the moment they get their prosthesis, they're ready to function as much,
Wow. And so do you manufacture them here, or is it where we take a cast or something like that, send it to a guy in the States, and then they come back with it?
This is a custom made, so it needs to be, I have to take all the measurement on hand, whatever they have, then process them here. If we have them, in a hospital.
Yeah, for a while. But I mean, is that the luxury that's available to you all the time, or do you find them going, okay, I'm done, I've got the surgery done, no more leg, I'm going to the house. Call me when you got my leg ready, when you have the replacement ready.
Well, mostly it's better if you go to the clinics, wherever there's some manufacturers, and so they can see everything. They can assess your health. You see, this involves a lot of things.
Oh yeah,
it's not only the mold taken from your stump. It's including your health. How can you function if you're healthy enough, and the shape of your stump, how it's been done. If it is in, you don't have no contractures, or your knee is ready for prosthetics, and educating them is the most.
Well, I've got to say, you're learning to walk again. It's not as simple as, when you were legs go this way, legs go that way. You've got a prosthetic device. You have to learn, number one, to live with it, and number two, how to control that. And it's not going to be the same as the other legs. So it's like playing the piano. You got one thing happening with one hand and a whole other thing happening with another, and you've got to learn to do it simultaneously.
Well, that's the most really important thing is for them to understand how the function of the prosthesis.
Yeah,
you cannot always get them 100% what they used to have the actual leg before.
About how long does it take somebody to get used to living with a prosthetic device, a hand device or a leg device?
Well, initially, you can learn them in about 2-3 months. You can learn how to walk on it. And if you will listen, understand all the things that I instruct you or anything, you're gonna do well.
A couple of last month before, I want to say GRMC brought in these therapists that came in, mostly speech therapists. But I know that you've got other therapists that are available at GRMC. So at some point, you've worked as much as you can on the patient, and then you give it to another therapist, and they will take it from there for the training.
Yeah, that's the continuation of care.
And then when do they come back to see you? How often? Because it sounds to me like you would become a permanent part of my life for a little bit while we're undergoing the therapy, while I'm learning to walk again, or use this to drink beer or whatever. So I would need to come back and see you on a regular basis, right?
They will see me if they have a problem, most especially fitting. And also prosthesis is like a shoe that you buy, like you wear them, they worn out. So within 3 years, you might want to see me for me to, like check what's going on with your prosthesis, if it is still in good shape, or anything needs to be replaced, parts, or it can need to be replaced, the whole thing.
So what kind of materials are we making prosthetic devices out of in 2020? What's the big? I imagine you got to go to a bunch of medical conventions and things like that, where you've got these guys that are showing you, okay, here's the state. This is the new Cadillac in prosthetic arms and legs.
Yeah, I used to go to those conventions when I was in States, but here in Guam, hospital doesn't have this kind of process. So,
right.
But mostly there
got to be magazines and websites.
Yes,
and things like this.
I'm checking once in a while, but it's almost the same.
Yeah.
What they have, different systems, different use. Like you say, if you're going to run, you're not gonna have the same prosthesis with person walking. Well,
I'd like to have a choice. Maybe a prosthetic device that looks like somebody's leg. It would look like my leg. It painted up, and even right down to here's where the hair looks like before the surgery, and so that's what I'd wear when I go to the beach, right? And nobody'd know that I got a prosthetic leg.
Yeah, all of those can be done because we have the technology long time ago. But what you need is, like, let's say when you go swimming.
Yeah.
You'll be able to swim your leg, so there's another leg for that. If you want to go running,
I don't want a blade.
Yeah, the blade.
I want those blades because there's a certain. It's got to be 100% with a return on those. It's not like running on regular legs, and you've got to. There's a minor amount of bounce that you get.
Ray, please don't get your legs cut off just to have blades,
but it's fascinating.
That just seems like something you would do.
If I got to get my times down, maybe that's the way I'm going to do something like that. Although my guess is that the good doctor over here probably would not remove one of my still functioning legs because I wanted to run faster. I get that. But I was talking about materials and things like that. Again, the idea I think with some of the prosthetics is to return functionality, but also to be able to give your patient a semblance of normalcy. I don't want to walk around with something that is obviously a prosthetic.
Yeah, we use a lot of carbon fiberglass to be more strong and lightweight.
Yeah.
And we use titanium for not getting any rust and everything. It's lightweight but strong. And we have all those different kind of movable ankles to imitate at least 80% of the function of the dorsiflexion plant, the movement of your foot, like walking in an even ground or stepping on a stone. If you have those kind of more axial, different, those expensive foot, then at least 80-90% you can get a little bit more normal walking without having a lot of problems.
Interesting conversation, folks. If, like I said, if you got questions, hit us up on Facebook Live. And usually, what happens when I got folks like this here, if you've got a question that requires an answer or at least some kind of follow through, somebody from Guam Regional Medical City is lurking on the Facebook page, and we'll be able to answer and give you contact information for these guys. How would I see you, Doc? Doc and Manny, if if I decide that I've got these problems, my doctor says, well, maybe it's time that we consider seeing an orthopedic surgeon. What's the step, the procedure to go through so I'm sitting in front of you one day?
I see a lot of referrals from the local docs. A lot of times, some people who I've seen before, they just come in for the same problem.
What information should I have with me? I mean, let me talk to the technicians here.
Yeah,
okay, first you bring your credit card, and then we'll find out. It's like when I got my LASIK done. You go, you know Jack Arroyo, right? So you go to his place. He's not there anymore, but back in the day when I got my LASIK taken care of, I went there, and there's 5 or 6, 7 different tests that you've got to do, and at the end of it, the lady says, "Okay, we have one more test for you," and I said, "What's that?" She says, "A credit card test, and we're going to run your credit card for $700 an eye, and if you pass, then congratulations, you are now our customer. You are officially a patient with us."
But basically, when they referred to us, they read up all the X-rays available, MRI, whatever.
I'm sure that by the time, by the time they get to you, ladies, they've got a pretty hefty folder of information for you. Are there things specifically that you're looking for? You know, the information from a patient's doctor that they ought to have prepared.
So usually there are 2 different types of patients. Patients that are just being self-referred, meaning they don't need a referral, and they're just referring themselves. Let's say I have a knee pain, so they can come in. We can assess them, but we do tell them to bring, like if they have any documents that were seen outside a different clinic, bring that documents, anything related pertaining to the knee. Most especially the X-rays, put it in a CD. Dr. Galang does prefer, to see the images in a CD. And then if it's an MRI, you just bring the report.
Right.
Yeah, so those are the things that it's pretty easy to actually get seen, because especially with fractures, we have a time frame that they need to be seen within a week. We receive the referral. So we call them, we schedule them, and they just be seen.
Okay. Now, I'm just going to say, in the case of a break or a fracture or something like that, wouldn't they have taken care of me in the emergency room and doing some kind of setting already? So there's a little bit of prep work that gets done. And so if I think I need to then go and see you, and then you take a look at the work that was done, the nature of the break, and then determine whether surgery is going to be required.
Temporarily, they put them in a splint, and if they need surgery, it might take another week before you do it if they're too swollen.
What kind of surgery? I mean, we were talking about different things, grafts, bone grafts, and things like that. But Handyman Manny can't be the only one that gets to play with cool technology. So I mean, if you're in the operating room, I mean, do you have something like a power drill or heavy duty screwdrivers?
We use now in orthopedics we use a lot of different plates, screws. They're actually bone specific. Let's say you're gonna use this part of the radius, there's an implant for that. The ankle, there's also an implant for that. A plate.
And are varying sizes? Because I can imagine that they would be very big, but in the kind of precise world that we live in now, you might be able to get them in very small sizes and just something that will take care of and cover up the fracture. Right. Now, are we still using power drills, or what about adhesives?
No.
There's no crazy glue?
No, we use cement once in a while for very old people or very fragile, the bone.
Yeah.
But it's not done very often.
But for the most part, so if I needed to put a plate or something like in there, then you put the plate down and then screw it in, and then that's it.
If you need a graft, we'll take it locally somewhere.
All right. Now, I told you there was going to be dumb questions here, so I'm going to be running. I'm your patient. I broke my leg, and you put a plate in there, so you keep all of the bones together, and it's strong, structurally sound, which is important. Otherwise, I'm not going to be able to walk or run. But then the question is, I got to go through the airport here. What happens at the airport? Well, I've got this metal in my.
Yeah, the new ones now, they don't cause any problem.
Huh.
Yes, the old ones they do.
I'll be darned.
Yeah, they I don't know what they did to it technology-wise. It's not going to show.
All right, so it's not this. The question is, why don't the terrorists make guns out of that same material and then be able to? No, okay, so don't follow any of that bad advice that I'm handing out on the radio here. It's great to have these docs. I'm just wondering now, how did you get the name Handy Manny? This is a question so important they wrote it down on the question sheet. Why do people call you Handy Manny?
Well, I'm the MacGyver of orthopedic.
MacGyver.
Anything you need, well, Dr. Galang will ask me things on needed this kind of device, I'll produce them.
And so
anything that I can put my hands on, I will make them to be possible.
You're the guy that will procure it one way or the other.
That's correct. I'll find a way.
So the listener was asking about the AFO prototypes. What is an AFO prototype?
Well, there is a different kind of AFO. They have one that we call them off the shelves, like already small, medium, large. And they have different kind of AFO that you can use. There is the one that helps people with rough feet. Some people with, they just have some surgery on their ankle and they need some support in their movement of their ankle. They're different kinds. So it's a vast AFOs.
So go see the doctor. Doctor, take a look, see if you actually need one of these things, and if you do, then Manny will find it for you or make it for you.
Whatever needed.
Whatever is going to be required. And Pam Duval wondering, we were talking about the different kinds of prosthetics that you can get. Get the kind that mimic what you're doing, or maybe something that you can use for running and maybe swimming. They've got a prosthetic device that is available. So, does it make your foot look like a fin?
Well, actually, the ankle of that swimming leg, there is an angle that you can lock on for the pin. So you're swimming, swimming ploppers. You angle them, lock them, and you have the ploppers, and all you have to do is use your knee.
Use your leg.
Then when you're going to start walking again, unlock it. Put it back in normal, then you do as from walking.
That's something else.
And this is waterproof.
Now, what Mike was talking about a couple of minutes ago and making a joke about it, no, Ray, we're not going to amputate your legs so you can get blades. Actually, there are people that do not like runners with blades, notwithstanding any of the pain or discomfort they've had to endure losing their legs. But some of the runners that take a look at guys with basically these springs that they're running with, that really does bring their times down. They're running at much faster speeds as a result of the kinetic changes, because now we're using these metal bands and there's expansion and contraction and an energy exchange that runners with their regular legs don't get. So there's runners who don't like to run in competition with these guys, and for the most part I think they are segregated. But Pam wanted to know if they had one like in that Kingsman movie where we can get blades that are actually blades. That will cut you and slice into flesh.
Oh no,
we don't
this is more like made from carbon fibers and computerized design as with the spring type. More like if you use metal for spring before, they use carbon fiber for just a spring with enough computation. Those engineers compute all the load and the unload, the energy storing of that blade that you use depends on the person's weight and activity.
So you might not be able to get the same effect as you did with the Kingsman movie. Now, was it Game of Death with Bruce Lee? What's the one where he goes to that island and he's got to beat the guy with the prosthetic that's a bear claw and a prosthetic with the knife? Come on, help me out here. I'm just saying. If I lost a hand, I'm sure I'd like to have a variety of different things that I could replace it with.
That's correct.
Right.
That's a removable hand.
Exactly.
You can remove it with the hooks.
Yeah.
You can put a spoon, forks.
and see, he's laughing, but I'm sure he's already done it.
Yes, I did. I've done them all for all those.
The kind of technology and the kind of folks waiting for you. There's information on Facebook Live on how you can get a hold of these guys, who your doctor needs to make arrangements with, and how to get the referrals to go see Dr. Galang and Handy Manny and the technician ladies here. Thanks so much for coming by the radio station. This is, I hope all of the rest of the partner interviews I get to do, I hope they're all as much fun as this one was today. It is a good time.
Yes, it is.
It's 9:54. I'm going to take a last break of the program while the commercials are playing. We're going to get a couple of big selfies taken care of, and I'll wrap up the program right after these.
Hi, welcome to this ad for new Subway sliders, starting at $1.99 each. How do you want it?
Cheer Squad. Woo! Go Subway sliders, starting at $1.99 each. Give me a ham and jack slider.
Ham and jack slider.
Give me an Italian spice slider.
Italian spice slider.
What's that spell?
It doesn't really spell anything.
New Subway sliders starting at $1.99 each. Go Sliders!
Subway, make it what you want.